Hello, my name is Dr. Farman Ali and I am a GP family physician. One of the most common questions is my headache serious? Now, serious headaches include subarachnoid headache. This is caused by bleeding in the brain. The headache starts extremely suddenly and it is also referred to as a thunderclap headache. Patients develop a severe headache within a few seconds. They may have associated neck stiffness or become unconscious. Another type of serious headaches is caused by meningitis, which is an infection of the covering of the brain. This is usually associated with a rash, feeling sick, high temperature, and patients will not be able to bear strong light, also known as photophobia. Patients will have a stiff neck and would be unable to bend the head so that the chin touches the chest, even if you try to relax. Patients are usually very unwell, hot, sweaty, and very ill. Another type of serious headaches is giant cell arteritis or temporal arteritis. This happens in patients over the age of 50, and this is caused by inflammation of the blood vessels in the temples and around the eye. There is associated scalp tenderness in these patients, and patients will notice that when they are combing their hair, and made worse when they are chewing. Temporal arteritis is serious because if it is not treated, it can cause sudden loss of eyesight. The treatment is urgent blood tests, a biopsy, and a course of steroids is started. Brain tumor can cause headaches. Usually the headache of the brain tumor is present on waking in the morning. It is worse on sitting up and gets steadily worse from day to day. It's a never easing headache and does not disappear. It can sometimes be made worse by coughing or sneezing. So, what are the red flag signs in patients who require further investigations? The kind of symptoms that make a doctor wish to do further tests are the red flag signs, and I will go through them one by one. If a patient had a serious, significant head injury in the previous 3 months, if the headaches are worsening and accompanied by high temperature, if the headache develops and there is associated speech and balance problems with it, if you have developed memory issues and changes in behavior as well as headache, this requires further investigations. Some other red flag signs are if a patient is confused or muddled with the headache, if the headache started when you coughed or sneezed or strained, if the headache is worse when you sit or stand, if the headache is associated with red and painful eyes, if the headache are not like anything that you have experienced before. Unexplained sickness with headache also needs investigation. Patients with low immunity, such as those with HIV or those who are on steroid medication, which suppresses their immune system, they need further investigation. There are certain type of cancers that can spread to the brain, and those patients require further investigations. Thank you very much.